Let me bring in Dr. Agni Kumar. He is a doctor. He's also a marathon runner himself. Dr. Kumar, my question to you first is this. To try and understand, I saw some visuals over the weekend of people running in when AQI was 400. I saw also visuals of people cycling out, going out when, again, the AQI levels are far bad. Not with masks, nothing at all. In your opinion, first up, and somebody who's an avid runner himself, do you think this should be happening in the current circumstances, in the current weather conditions?
Hi, Sonal. Thank you so much for having me. No, bottom line, long story short, not at all. So even when we're at rest, okay, we usually breathe about 5 to 6 liters of air at rest, at a relaxed cardiac output. When you're exercising, your breath, your respiratory demand can go up till 100 liters, 50 liters per minute. Like that's how fast you're breathing. Okay. Now imagine when you're taking in 20 liters, 50 liters, 100 liters of that poisonous smog, you're exponentially increasing your risk of chronic lung damage. You're exponentially increasing your risk of emphysema, COPD, asthma. So back in the days, when the AQI was still better, living one day in Delhi was equivalent to smoking 20 cigarettes in a day. Now, when we say living one day, we mean when you're normally eating, breathing, and just breathing at rest. Now, when you're exercising at such high cardiac output, you're doing yourself the biggest disservice.
I see. So what do you have to say? I mean, this seems like something all of us should know already, right? Why do you
Yeah.
think people, do they not have basic knowledge about this, or they are still relying on the pollution meter, which is now coming under the scanner as well? Why do you think people are still stepping out? I happen to actually speak to a friend of mine who went for one of these runs, and I said that, what were you thinking? This weather is so bad. She's like, it's better. I can't help it, but I can't take a risk with my health, and I got to run. And look at them. There are hundreds, if not thousands, really out there. So what is the problem here? Are people just not understanding?
I think it's herd mentality. If you see a couple of people doing it, you want to do it. And by and large, people feel that running is good for your health, cycling is good for your health. Yes, of course it is good for your health. But does running behind a car's exhaust pipe, is that good for your health? Of course not. So if I'm running behind, a pollution smoke, that exhaust vehicle, and I'm just breathing in carbon dioxide, carbon monoxide, sulfur dioxide, I'm actually causing myself more damage, more harm than good. So when the weather is so bad, please do not step out. Please do not exercise in that. The only luxury one, I mean, if you're luxurious enough to have air purifiers, where inside the room the AQI is very low, inside the gym the AQI is low. Okay, fair enough. That's your only excuse. But there is no way one should be doing these sort of activities when the weather is so bad. You're actually smoking, so you're smoking. It's effectively you're smoking. You've called 1,000 people to smoke.
Got it. But Dr. Kumar, the point is these were government organized events, right? Uh,
Hmm.
these were people who, from RWAs, teachers, etc., who were all sort of, going in. So what does it say about our basic knowledge of
So
how we
it's
look at air and this entire air, emergency that we are in midst of, but we don't seem to be understanding?
we actually don't. I think sometimes we take it for granted. I would like to jog your memory back to COVID when people were against mass gatherings. And when lockdown had just started, people were all accumulating that we'll do yoga together, we'll do fitness together, we'll improve our lungs so much that COVID will not happen. So we come from a country where all this is happening. People do not have, I think the word is, for lack of a better word, basic common sense. Um, but that's something to be, that's where us health educators, we need to come forward and speak about it. And I'm glad you're talking about this, because this is insanity. This is nothing short of stupidity to be holding such mass marathons, any sort of cycling events where you're swimming in smoke, you're swimming in smog. It's like, the Yamuna, the river is so polluted. I wouldn't recommend going there for a swim, would you? So why would you run in this kind of weather?
Nothing short of stupidity is what you're saying. But for those who perhaps don't get it even now, could you explain to us what exactly happens when you exert your body or get into a physical activity, when the AQI is, or in fact, first tell me, what is a threshold? At what AQI should you say no outdoor activities, no exercising in these AQI?
So if we were to go by the threshold, then nobody in India could ever exercise. Uh, but let's say, so when you AQI less than, I think, 40 to 50 is considered in the good healthy category, which you see in a lot of, say, European countries, America, where the standards are they're much stringent, where pollution is very much under control, right? But let's just say, I'll explain it very simple my language why one should not exercise when the AQI is so bad. So right now, you and I, we're not running, we're just talking, which means our respiratory rate is roughly 14 to 20 a minute. Roughly, we are taking in only 5 liters of air per minute. Okay. Now, this 5 liters of air is definitely contaminated because we're taking in all the smoke, the smog, right? Now, imagine when you have to start breathing 100 liters a minute, 50 liters a minute of all of this smoke, smog, dust, dirt, grime. Please note what you're doing to your lungs, right? So it's a very simple question. Is smoking 5 cigarettes a day bad, or is smoking 20 cigarettes a day worse? Of course, smoking 20 cigarettes a day is worse. So when you're exercising in such bad weather conditions, you're taking in so much exponentially higher particulate matter. Now, there is, for the body, there is no difference whether it is cigarette smoke, whether it is vape, whether it's that chulha which emits a lot of burns, where emits a lot of gaseous material, or whether it is pollution. Smoke is smoke, pollution is pollution. So effectively, it's equivalent to you smoking, vaping, running in this kind of weather. So not a good idea.
You know, I feel that what you just said, that if we were to look at WHO recommended levels, we would never be able to exercise in India. And I think that's what gets people really irritated. And that's what people say that, okay, this way we'll never be able to do it, so might as well just do it. I think that's where it largely comes from. But thank you so much for joining us.